What's up, guys? This is Brad at No Nonsense Medical, where our goal is to communicate and inspire authentic discussions in a medical profession and lifestyle. Today, I wanted to go in and talk about MD or DO versus PA or NP. There are a lot of opinions out there, but again, here at No Nonsense Medical, we try to give you authentic information. MD stands for medical doctor, DO stands for doctor of osteopathic medicine, and then there's physician assistant for PA and nurse practitioner NP. Now, MD and DO are synonymous. Basically, that their training is a little different, but it's pretty similar, and they both qualify once they go through their program to take their different um, step form fashion of board certifications, etc. And they can still go into the same areas of medicine. And for the most part, it's the same thing with physician assistant or nurse practitioner as well. Right. And as far as figuring out which is going to be the right fit for you, there are five main points that you really need to sit down and figure out because there's a large variation in the years of education, the lateral mobility or lack of, big differences in lifestyle slash family, which level of autonomy of being on your own are you comfortable with, and of course, last but not least, there are big salary differences, especially in the different fields that these professionals can go into. As far as the education requirements go, the MD or DO route requires 4 years of undergrad with 4 years of med school and an additional 3 to 7 years of residency. That's the minimum years in college education for 11 years. Now, the more years, there's more cost involved in that, but also more salary in the end. As far as the PA route goes, there's 4 years of undergrad, 2 to 3 years of postgraduate work, with the minimum years of college education at about 6 years. And then for a nurse practitioner, there's 4 years of undergrad with 18 months to 3 years of postgraduate work, with the minimum years in college of 5.5 years. However, friends of mine that have went to the nurse practitioner program that are shorter in duration at the 18-month mark have gave me some insights on those programs. Usually they do require that you have quite a bit of clinical experience already, um, but even then, that's only 18 months. That's less time for you to prepare, for you to study for your boards, and for the most part, all of them told me they're pretty fearful and pretty anxious when that time comes that they're about to sit for their boards and start practicing medicine on their own. Um, and so the more years of education also means more training before you are in the hot seat, as they say. All right, as far as lateral mobility or flexibility, it varies between MD and DO versus PA and MP. Now, doctors, they have to go and finish a dedicated residency and become board certified in that residency, and that continues on if they specialize even further. And then with PA and nurse practitioners, they do not have to pass any uh, board certifications for any specialty that they work in. So you could, for instance, work in emergency medicine and also orthopedic surgery. And I've had friends who actually have done both, and they've went to different specialties while they were practicing. Autonomy. Now, doctors and NPs and PAs have different levels of autonomy. Obviously, a doctor is going to be the most autonomous and be the most independent, and then PAs and nurse practitioners are going to have usually a supervising physician, but in some situations that definitely varies. The some of the pros and cons of being more autonomous as a doctor is, for instance, if you have your own clinic, office, you get to control how basically everything is ran and the types of patients or procedures slash surgeries that you choose that you want to do. Now, as far as on the PA or nurse practitioner side, that will definitely vary a lot of times we do have supervising physicians, and they'll want us to see certain types of patients. A lot of times less critical patients, not always the case, but they control that aspect. So you'll have to figure out what's more important for you as far as how independent you want to be. Now, some states do have varying amounts of supervision that is required, and sometimes a PA or nurse practitioner can have their own clinic with a supervising physician nowhere near them. And then some states require that a supervising physician has to be within so many miles of the geographical location. All right, with lifestyle and family, this will vary quite a bit depending on if you are going to be a doctor versus a PA or NP, and then also depending on the specialty that you go into. Um, so, with being a doctor, there are clinic office hours, board meetings, conferences, surgery schedule, if you do surgeries, and then also, that takes up a lot of time, and then fitting in your private time with your family, friends, to do your hobby and personal interests. Now, the reason why doctors typically spend more hours as far as this goes is, um, you know, back to the autonomy slide. They're usually the ones who are running the show, as they say, and are responsible for all these things. Now, usually a PA or nurse practitioner, on general basis, will not spend as much time, but again, that varies quite a bit depending on the specialty. So if a doctor or even a PA nurse practitioner were working in let's say trauma surgery, they'll be there quite a bit compared to someone who owns a rural family medicine or internal medicine clinic. Alright everybody, that's it for this video. Please hit the like button and subscribe to my channel. And down in the comments area, if you have any questions, especially if you're seeking to be a physician, PA, nurse practitioner, let me know. Also, let me know if you have any suggestions for future videos. Thank you.